Welcome to the third video in this module. In this video, we'll review the symptoms of PTSD or post-traumatic stress disorder. Next, we'll explore the findings of the now famous ACE study to see how chronic unresolved trauma in childhood results in more clinical problems than merely traditional PTSD alone. So let's get started. Let's start off talking about what is PTSD in the first place. Well, PTSD literally stands for post-traumatic stress disorder. In other words, PTSD refers to what I like to think of as the trauma after the trauma. PTSD occurs when the original trauma starts and stops, but the ongoing effects of the trauma cause even more problems than the original trauma itself. And that's precisely why it's called post-traumatic stress disorder. PTSD has 4 different categories of symptoms. The first category of symptoms, what they all have in common, is these are different ways in which the person who survived the trauma continues to re-experience the trauma. And this happens intrusively. So one way that happens is memories of the original trauma just happen to show up, appear when the person doesn't want them. The person isn't trying to actively think about the trauma. It just happens. Another way this can occur is when the person dreams about the trauma. In other words, has nightmares. What can also happen is when the person experiences what's called a flashback. Flashback happens when the person literally feels like they're re-experiencing the trauma in real time. So obviously they're not, but it feels like it. Another way a trauma survivor can re-experience the original trauma is whenever there's a trauma reminder, something that makes the person remember the original trauma and therefore have an emotional or physical reaction to it. A good example of that might be a panic attack. Something happens that reminds the person of the original trauma, and all of a sudden they have a sense of dread or panic. They feel this fear, apprehension, and they might even start to feel physical symptoms. So, for example, they might start to sweat, or their heart might start to palpitate, or they might even start to shake. Another way that people sometimes re-experience the original trauma is this fascinating phenomenon called reenactment. There's different theories out there, but basically reenactment happens when someone who has survived trauma inadvertently, subconsciously, or unintentionally ends up in situations over and over again in which the original trauma is likely to reoccur. So those are the re-experiencing symptoms. We also have the avoidance symptoms. And there's 2 different categories here, internal reminders and external reminders. Basically, someone that has survived trauma wants to avoid anything that even remotely resembles the original trauma. So internal reminders refers to thoughts or feelings or memories of the trauma. They don't want to have these thoughts or feelings or memories, so they do something, anything, to avoid having them. External reminders refers to things like people, places, conversations, activities, objects, or situations that remind them of the original trauma. They want to avoid anything that reminds them of the trauma, whether it's happening inside their own heads or outside of themselves. But a fascinating concept I want you to notice at this point is how someone who has been traumatized is basically experiencing a civil war with themselves. Because on one hand, the person's mind is causing them to re-experiencing the trauma. But then on the other hand, the person doesn't want to think about or remember the trauma, so they're also trying to avoid it at the same exact time. Another category of PTSD symptoms has to do with changes in mood and cognition. Some examples of that are, one is dissociative amnesia, gaps in memory related to the original trauma. Another example of a change in cognition is negative beliefs. Someone that's been traumatized tends to develop negative beliefs about themselves or others or the world at large. And one specific example of that is a distorted sense of self-blame. So people who have been traumatized tend to inappropriately and disproportionately blame themselves for the trauma having occurred. Some examples of changes in mood include an increase in negative emotions such as anger, anxiety, depression, as well as a decrease in positive emotions. People who have been traumatized a lot of times describe themselves as feeling numb, They don't get excited that easily. Similar to that is a sense of diminished interest. Things that previously really interested the person really don't grab their interest anymore. Another example of changes in mood and cognition is a sense of interpersonal attachment. Someone who has been traumatized a lot of times struggles to connect with other people. They struggle with empathy or attunement. And then finally, the fourth cluster of PTSD symptoms, what all of these symptoms have in common is they're all changes in arousal or reactivity. For example, people who have been traumatized might become more irritable, or more aggressive, maybe more reckless or self-destructive. In other words, more impulsive. They also might develop what's called hypervigilance. In other words, never letting down your guard, always being super alert to any threat or any danger. Also having an exaggerated startle response. In other words, quickly reacting if something comes to your attention or something scares you. People who have been traumatized also tend to have more difficulty with concentrating and more difficulty sleeping. If you think about it, that makes sense because they're constantly thinking about the trauma, remembering the trauma, so it makes it more difficult to concentrate, which even affects them at night because even when they're trying to sleep, they can't because they're still thinking about the trauma or they have nightmares about the trauma, which speaks to the point I made earlier. And that is PTSD is all about the trauma after the trauma. Once you have enough of these symptoms start to create even more symptoms. However, since the original diagnosis of PTSD emerged, we've actually learned a lot more about trauma. And one of the reasons we've learned a lot more about trauma is through the now classic ACE study. The ACE study examined adverse childhood experiences in 17,000 different individuals. Now, the original purpose of this study actually had nothing to do with trauma per se. The original purpose of this study was actually to simplify the intake process at an obesity clinic. There was some doctors that were running an obesity clinic, and they wanted to make their intake process more efficient, so they identified 10 basic themes from childhood that they were going to use to screen their patients. So here are the 10 themes that they identified. And what you'll notice is the first 5 themes, what they all have in common is these are things that can happen directly to a child. So emotional abuse, emotional neglect, physical abuse, physical neglect, and sexual abuse. And then the next 5 themes that they identified refer to conditions of the household. So, for example, households in which there's domestic violence, in other words, lots of physical aggression, or substance abuse, or mental illness in at least one of the parents, or removal of a caregiver through incarceration or through divorce or separation. What they found was, first of all, that each of these 10 themes were very strong predictors of obesity later on in life. And what they also found out was that these correlations were very linear and very clear. So in other words, the more ACEs in childhood, the more problems in adulthood. And they found that this applied to many life domains above and beyond obesity. For example, they also found that the more ACEs someone had in childhood, the more difficulty they had regulating emotions as an adult. And they found this to be true with depression, with anxiety, and with anger. Something else they found out was that the more ACEs someone had in childhood, the more difficulty they had with substance abuse as adults. They found that to be true with nicotine consumption, such as smoking. They found that to be true with alcohol consumption. They also found this to be true with consumption of illegal drugs, and then, in particular, intravenous drugs. So people with more ACEs in childhood, just in general, had more difficulty with substance abuse as adults. They also found this to apply to relationships. The more ACEs in childhood, the more difficulty with relationships in adulthood. They found this to be true with regards to promiscuity. The more ACEs in childhood, the more sexual partners in adulthood. They found this to be true with the prevalence of sexually transmitted diseases. So the more ACEs in childhood, the more sexually related diseases in adulthood. And they also found this to be true with number of failed marriages. The more ACEs in childhood, the more difficulty with long-term commitments in adulthood. And they even found that the more ACEs in childhood, the more likely the person would experience suicide attempts as an adult. So, what did we learn from this ACE study? Basically, what we learned was that people with lots of trauma in childhood end up with more problems in adulthood than simple traditional PTSD alone. We learned from the ACE study and lots of other research that people with chronic histories of childhood trauma end up with the following difficulties in adulthood: physiological dysregulation, emotional dysregulation, attentional dysregulation, behavioral dysregulation, and relational dysregulation, both with self and others. If we take all of this dysregulation combined, that's what we mean when we say complex or developmental trauma. So it is possible to have all of this dysregulation going on in addition to just simple or traditional PTSD. And that's precisely why we need a model of psychotherapy to help clients stabilize before they start processing their traumatic experiences. For example, if we're working with a client that is physiologically dysregulated, emotionally dysregulated, behaviorally dysregulated, relationally dysregulated, and even attentionally dysregulated, how in the world do you plan on doing trauma processing with that client? That would obviously not be very safe or healthy or clinically indicated. So we need to stabilize that dysregulation first. And that's the whole point of trauma-focused DBT. So let's just summarize with a few key points here. First key point: simple PTSD includes the following symptom clusters: intrusive re-experiencing of the trauma, avoidance of trauma reminders, changes in mood and cognition, and increased arousal and reactivity. Simple PTSD occurs when someone has relatively stable pre-mortgage functioning prior to the traumatic event. Key point number 2. The ACE study has convincingly demonstrated the profound impact chronic childhood trauma has on adulthood functioning. For example, the more adverse experiences a child had in childhood, the more difficulty they will have in regulating emotions, managing impulses, and dealing with other people. And finally, key point number 3. The research is clear that people who have endured chronic trauma throughout their childhoods, for example, while their brains are still developing, experience more pronounced and more enduring symptoms than simple PTSD alone. That's precisely why we need a model of psychotherapy to help clients stabilize before they start processing their traumatic experiences.